Before checking blood pressure, it is important for the client to have been seated at rest for at least 5 minutes. Along with this, they should have refrained from any stimulants such as caffeine and nicotine for at least 30 minutes. You can check for the proper cuff size by checking to see which one fits snugly without being too tight or too loose. At least 80% of the arm should be enclosed by the cuff. With the client sitting with their feet flat, back supported, and arms at heart level, with no clothing covering their upper arm, you can then begin the process to measure blood pressure on the left arm. Using palpation technique, determine the location of the brachial artery. Once found, the cuff's rubber bladder can be placed with the center aligned with the brachial artery, about 1 inch above the antecubital fossa. Using the Velcro on the cuff, secure the cuff snugly around the arm and rest the client's arm at heart level. When putting on the stethoscope, be sure the prongs are facing towards the front of you. Also check to see if the stethoscope is on by tapping on the diaphragm of the stethoscope. If you cannot hear anything, rotate the diaphragm until you can. Place the diaphragm on the antecubital fossa along the brachial artery below the cuff. Do not place it underneath the lip of the cuff. With the valve tightened and the bulb in your hand, pump the bulb until 200 millimeters of mercury shows on the mamometer. Then slowly release the pressure by turning the valve slightly. The rate at which the pressure should be released is 2 to 5 millimeters of mercury per second. As the pressure is being released, you will be listening for the first Kharkov sound, which will sound like a thud from the stethoscope. This occurs in phase 1, and this will be your measurement for your systolic blood pressure. You will then listen for the very last Kharkov sound right before the K sounds disappear. This occurs in phase 5, and this will be the measurement for your diastolic blood pressure. You will then release the rest of the remaining pressure, then take off the cuff. After waiting at least 1 minute, you can remeasure the blood pressure on the same arm and then average out the two measured. Once you have gotten the values, you can then classify the client as either being normotensive, prehypertensive, or hypertensive. You are considered to have normal blood pressure if it is less than or equal to 120 over 80 millimeters per mercury. You're prehypertensive if it is between 120 over 80 and 139 over 89 millimeters per mercury. You're hypertensive if it is equal to or greater than 140 over 90 millimeters per mercury.